Hello, my topic is prostate cancer metastasis. My name is Oscar Yupabuñay, Medical English, Dr. Joe Moscoso. Definition: prostate cancer is one of the most common types of cancer in men. Prostate cancer usually grows slowly and initially remains confined to the prostate gland, where it may not cause serious harm, while some types of prostate cancer grow slowly and may need minimal or no treatment. Other types are aggressive and can spread quickly. Most prostate cancer are free from during screening with the prostate-specific antigen, blood test, and/or a digital rectal exam. If PSA levels are high, transrectal ultrasound is performed.
Considerations in advanced prostate cancer. Prostate cancer is the most commonly diagnosed cancer among men in the United States, excluding certain skin cancers. A common misperception about prostate cancer is that it is rarely fatal. In fact, it is the second leading cause of cancer-related death among men in the United States. While it is true that prostate cancer is largely curable when diagnosed and treated early, patients with advanced prostate cancer have a less favorable prognosis. Advanced prostate cancer is defined as cancer that has spread beyond the original tumor. The most recent statistics estimate that 3 out of 10 men are still alive 5 years after being diagnosed with advanced prostate cancer. Male hormones, such as testosterone, cause prostate cancer to grow and survive. Early treatments for prostate cancer attempt to lower levels of testosterone in the body. This is known as hormone therapy. However, prostate cancer tumors may eventually begin to grow again, even though levels of testosterone in the body are low. At this point, the cancer is considered to be advanced. Researchers are studying why this occurs to gain a better understanding of how to develop treatments for prostate cancer. Talk to your doctor about questions you may have about advanced prostate cancer. Recent basic science and medical evidence suggest that one possible reason that tumors continue to grow is that they become extremely sensitive to the low levels of testosterone that surround them. In this way, tumors can grow even though there are extremely low levels of testosterone in the bloodstream. Additionally, studies done in both animals and humans show that the tumor may begin to produce its own supply of testosterone. This means the tumor is capable of fueling its own growth. In other words, in advanced prostate cancer, there is evidence to suggest that the tumor may be providing its own testosterone so that it can grow without depending on other sources of testosterone production. Talk to your doctor about new information regarding advanced prostate cancer.
Application in medicine. Early detection is very important for its diagnosis. A general physical examination is performed to detect the presence of the tumor and its impact on the rest of the body. Emphasis should be placed on the lumbosacral, spine, pelvis, liver, and lung. For its detection, rectal examination and prostate-specific antigen (PSA) serum tests are used.
Over 80% of men live for 10 or more years after a diagnosis of prostate cancer. I've come to Cambridge University Hospital to speak with Dr. Vincent Nana Prakasam about some of the treatments that are available for this type of cancer. So Vincent, what are the most important factors when deciding what type of treatment a person should have?
The treatment options for prostate cancer are very much dependent on what kind of cancer an individual has and also the patient themselves. So if a cancer is confined to within the prostate gland, then we might be able to treat it by surgery or radiotherapy. But equally, sometimes there might be a very slow growing tumor, in which case we can just keep an eye on that. But the kind of cancer is determined by the size of it or the stage of a cancer, the type of cancer it is or the grade, and also the PSA test. And we use those three put together to create an idea of the risk of a particular individual dying of prostate cancer.
What treatments are available?
In general, there is surgery to remove the prostate gland, radiotherapy where you deliver high intensity radiation beams, or surveillance where we can monitor and just check on someone and defer treatment till later.
So a number of different options then, Vincent. How do you decide which one's best?
That decision is left to the patient in consultation with his consultant or nurse specialist, and comes down to whether the patient feels that a particular type of treatment is best suited for their lifestyle, and also the risks and side effects which may come about from that.
And what happens when treatment's finished?
After treatment's finished, the patient enters a phase of very close monitoring, and where they'll be seen regularly in the hospital, often with a PSA test measurement being done on a regular interval.
What about treatment for cancers that have spread?
When a cancer has spread beyond the prostate, then the most common treatment is hormone therapy, and that serves to keep the cancer under control. And many men can live for many years with that. And if that should fail, there are actually other drugs which can be used, chemotherapies, which again can be very effective.
Dealing with cancer is never easy, and this is especially so when deciding about treatments. But of course it helps if you know the facts. If you or anyone you know has been diagnosed with prostate cancer and you'd like further information, visit the Cancer Research UK website or see the other videos in this series.
Pros and cons. Almost 40% of patients come with advanced case, and that this has been attributed to the idiosyncrasy of people. Many of those who are diagnosed early and with a high probability of cure for sexual dysfunction and incontinence after treatment. However, he acknowledged that information about the placement of penile prosthesis and sphincter for incontinence may not have been disseminated among patients, and these collateral problems are treated with surgery and treatment. Issue appeared in Ecuador. Prostate cancer is the most common in the Ecuadorian men, and by 2020, the National Tumor Registry estimates that there will be 3,601 new patients with this disease. Prostate cancer has replaced gastric fat of incidence and mortality in men. However, in comparative volume ratio with other tumors, it represents proportionally the first part in mortality. Conclusion. Prostate cancer is a enormous study carried out, a change in daily medical practice due to isolated pretension and high incidence. It is imperative that health professionals now the main advance in the subject within of contribute of the timely diagnosis of the disease, which will therefore contribute to the application of better treatments and increase the possibilities of cure and better results.
The prostate is the gland below a man's bladder that produces fluid for semen. Prostate cancer is common among older men. It is rare in men younger than 40. Risk factors for developing prostate cancer include being over 65 years of age, family history, being African American, and some genetic changes.
Symptoms of prostate cancer may include problems passing urine, such as pain, difficulty starting or stopping the stream, or dribbling, low back pain, pain with ejaculation. Your doctor will diagnose prostate cancer by feeling the prostate through the wall of the rectum or doing a blood test for prostate-specific antigen, PSA. Other tests include ultrasound, X-rays, or biopsy.
Treatment often depends on the stage of the cancer, how fast the cancer grows and how different it is from surrounding tissue helps determine the stage. Men with prostate cancer have many treatment options. The treatment that's best for one man may not be best for another. The options include watchful waiting, surgery, radiation therapy, hormone therapy, and chemotherapy. You may have a combination of treatments.
Thank you.